I think in a general sense, the reward for me is making a connection with my patients and developing a long-term relationship, because most of my patients I do see not just once, but for years and years, and allowing them to trust me in guiding them to make the best healthcare decisions they can for themselves. I became interested in infectious disease initially in medical school with all my microbiology classes, and then in residency I ended up in South Florida, where I'm originally from, and so I was practicing in an area with a large HIV population, and so I wanted to be a part of that. And aside from HIV, I think just practicing with emerging diseases, tropical diseases, and now especially in the COVID era, I think it's just very exciting, and that always attracted me, and so I wanted to be part of that. Infectious disease is one of the fields that does connect every part of the body. I have to be preoccupied with every organ system and how that plays into how I will treat my patients. It's kind of a very comprehensive level that I have to look at with the data that's in front of me about my patients and how I'm going to help them the best way I can. We also take care of a lot of our transplant patients, including bone marrow transplant, solid organ transplant patients, and the infectious complications that go along with post-operative transplant patients. The very first goal I always try to accomplish with my patients is letting them know that I will listen first and foremost to their needs, their questions, explain to the best of my ability the way that they can understand how to improve their health, involving them in their care, because at the end of the day it's autonomy that we try to give to our patients, giving them all the information that they can to make the best decision together, but from their own standpoint. I think as humans we have to be loving of one another and acknowledging that we all come from different places physically, but we're all the same. I love learning about cultures from my Haitian populations, my Hispanic populations. I'm Hispanic myself, so I love that about South Florida. And I love the fact that I can give back to that community, the community that I grew up in, that I always loved, and just kind of playing a role in giving back.